Hi, my name is Greg Steward. I'm a CPO and the Clinical Education Director at Elevate Dynamics. As you may know, Elevate Dynamics currently focuses on carbon ankle foot orthoses, plantar flexion weakness, dorsiflexion weakness, and some mild instabilities or flexible deformities in the coronal plane. Our looks and designs are created with both the patient and the clinician in mind, what we like to call here at Elevate clinician-centric or patient-centric. As of now, we have 3 devices on the market. First is the Free Flow. The Free Flow is our posterior design that's utilized to support dorsiflexion weakness and mild hyperextension at the knee, with a posterior lateral design for comfort and ease to fit into shoes. Secondly, on the market, we have our anterior device, which is the Glide. The Glide provides support for dorsiflexors, mild plantar flexion weakness, as well as mild quadricep weakness. Last but not least, we have the Helix Band. The Helix Band is what we like to call our game changer. In the market right now, most carbon fiber AFOs, they focus on the sagittal plane. What we wanted to dive into is to treat more patients with the coronal plane instabilities that lack the support in traditional carbon fiber AFOs. Let's talk about the box. The design of the box we utilize to get rid of those bags and book bags thrown on your shelves. With the triangle box, we can stack inventory nice and neat on your shelf with easy access to anything you need. Now that we're on the topic of inventory, let's talk about how we reduce the complexity in operations and your shelves. We have 2 SKUs for the Free Flow and 2 SKUs for the Glide, left, right, and that's all you need. So we've heard some rumblings about how all sizes in one or universal sizes fit absolutely no one. Let us be absolutely clear in what we have. We have 25 sizes in each box. With the trimmable foot plate and the telescoping calf cuff or anterior shell, we have many different combinations that we can do. So whether you have somebody that's super tall with little tiny feet or somebody really, really short with really big feet, we got it all covered in our box. So both the anterior shell for the Glide and the posterior shell for the Free Flow are both heat moldable and trimmable for optimal fit and comfort. So talking about combinations of how we can fit different patients, the anterior shell on the Glide is telescoping, so we can increase or decrease the height of that anterior shell to be able to increase or decrease the ground reaction force for patients with mild knee instability at the toe off. Next, we have that lateral strut that we can place and translate and be able to align it posterior to the base of the fifth with the trimmable foot plate. Most devices on the market, when you order it, you get what you get. Some patients may have issues with that button up against the base of the fifth. What we have now is that trimmable foot plate to be able to trim that, adjust it to the patient, and then trim the anterior aspect of the device for a comfortable fit for that anterior strut. Secondly, the Free Flow has a posterior lateral strut, which fits into a shoe extremely nicely. The posterior aspect of that foot plate is trimmable, so we can get it into most shoes and we can get it into different varieties of shoes and not the big bulky shoes that a lot of people don't like or dislike. So we have that option as well. Our fabrication process is different from others on the market. We utilize a compression molding process. This process has manually laid up carbon layers and then put under high compression and high heat. What this process does is gets rid of any air bubbles or any voids. Getting rid of air bubbles or reducing voids reduces the chance of breakage in our devices. This process allows us for a clean, finished look, and the carbon is manually laid up and looks great when you give it to your patients. For our straps, we utilize a BOA system. The BOA system allows for easy donning and doffing, as well as micro adjustments for different patients with volume fluctuation. One unique thing that we have about our device is the ability to change the strap for patients with hand dexterity issues. So if you have a patient with left drop foot and that left hand has hand dexterity issues, we can utilize the strap, change it, and allow the patient to don and doff the device with their contralateral side. So we've all had a patient that we wish that we can put into a carbon device, but due to a flexible deformity in the coronal plane, we would have to move to a custom device. So as of right now, we've went over how we treat the sagittal plane with our off-the-shelf devices and the anterior device, the Glide, and the posterior device, the Free Flow. But when we want to move into is the coronal plane stability that we need to provide to some patients. So what we have is our Helix Band, last but not least. This is our dynamic strapping system to be able to stabilize the calcaneus and the midfoot in the coronal plane. All the devices on the market right now, they're great providing support in the sagittal plane, but not many do anything for the coronal plane. So with the Helix Band, it comes under the midfoot, across the tibia, and straps to the back. So the patient has the ability to increase or decrease the support they get from that Helix Band. Thanks for watching, thanks for listening. Now go out there, try some Elevate products, and help us empower a healthier world through movement.